Patricia. I'm a registered nurse and a licensed insurance agent. In this video, I'm going to go over the difference between Medicare and Medicaid. A lot of people think it's the same thing, and it's actually not. So in this video, I'm going to just get right into it and talk about the differences. And you may be eligible to apply for both Medicare and Medicaid. And if you are, I recommend that you do apply for both because you do get extra benefits when you have both, and you're really not paying for your healthcare or very little to no out of pocket. All right, so let's start with Medicare. Who's eligible for Medicare? So Medicare is something that we earn if you worked in the U.S. for 10 years or 40 quarters. Then you are eligible for Medicare when you turn 65. So that's the most common way of getting Medicare. Now there are some other situations. If you have end-stage renal disease or if you have ALS, then you are also eligible for Medicare as well, and certain disabilities. So if you are disabled for 24 months, the 25th month, then you can enroll in Medicare as well. So what about Medicaid? Is for low income individuals. So you do have to meet a low income requirement for you to be eligible for Medicaid. So who can apply for Medicaid? So if you are a parent of young children with low income, if you are a child, a pregnant woman, if you are in the foster care system, and also if you are disabled, you can apply for Medicaid. So who are these programs regulated by? So with Medicare, Medicare is regulated by the federal government. Medicaid is regulated by the federal government, and it is state specific as well. So different states have their different version of Medicaid, and it could be named something different in different states. Like for example, in California, Medicaid is called Medi-Cal. In Washington, it's called Apple Health. So it is called different names in different states, but it basically has the same principles with the program, which is Medicaid. And like I said, they're for low income individuals. It's not something that you earn or paid into. Medicare, you earned it, you paid your Medicare taxes. Medicaid is more for low income individuals. It's basically applying for welfare, okay? So that's the difference between Medicare and Medicaid in that sense. Medicaid is pretty much welfare, and Medicare is a program that you earn by paying Medicare taxes. What is covered under both of these programs? If I have not stated before, both of these programs are health insurance programs. So Medicare is broken into 4 parts. So let's talk about the 4 parts of Medicare really quick. Medicare Part A covers your hospital. So it is also known as your hospital insurance. So it covers inpatient hospital care. It covers skilled nursing care as well. So skilled nursing care would be if you fractured a hip or something and you need to go to a skilled nursing home to get rehab. It also covers hospice and home health as well. Now, Part B, like I said, Medicare has different parts. So Part B is also known as your medical insurance. So Part B covers your outpatient services, such as your doctor visits and other healthcare providers. It also covers home health care, durable medical equipment like your wheelchair, your walker, hospital beds, and other equipment. And it also covers preventative care as well, like your screenings, your shots, vaccinations, and your yearly wellness visits. Medicare also has Part C. With Part C, these are Medicare Advantage companies. These are private insurance companies that is contracted with Original Medicare, and it offers everything that Original Medicare offers and extra benefits such as dental, vision, transportation, hearing, and such. So that is Medicare Part C. There are Medicare Advantage plans, and they're usually bundled all in one. It covers your Part A, covers your Part B, and it also covers what we're going to go over next, which is Part D, which is your medications. So if you have Medicare Part D, that helps cover your prescription drugs. And like I said, if you have a Medicare Advantage plan, a lot of these plans are bundled all in one. So your drug coverage is included and such. All right, so let's talk about what does Medicaid cover. So Medicaid is going to cover your basic health, such as hospital visits. It's also going to cover your co-pays, your doctor visits, labs and x-rays and things like that, like the Medicare as well. Now, one thing that Medicaid covers that Medicare does not cover is long-term care. So if you needed to move into a nursing facility for long-term care services, Medicare does not cover that, but Medicaid does. So a lot of times when an individual needs long-term care, they need to live in a skilled nursing facility, they will apply for Medicaid, so that way Medicaid can pay for their long-term care. So that is the difference between Medicare and Medicaid when it comes to what they cover. So if you happen to move out of your state and say you have Medicaid, then you will have to enroll in the new state Medicaid program. Same thing with a Medicare Advantage plan. If you have a Medicare Advantage plan in a particular state, and if you moved out of that state, you will also have to apply for a Medicare Advantage plan in that new state. Now, if you have a Medicare supplement, meaning that you kept original Medicare and you added a Medicare supplement like a Plan N or a Plan G, you can move with that supplement. That is not an issue at all. But with the Medicare Advantage and with Medicaid, if you move, you do have to go ahead and apply for that state's Medicare Advantage plans or that state's Medicaid program. Like we stated earlier, both Medicare and Medicaid will help pay for your hospital stay, also will help for your co-payments, your doctor visits, and such. So if you have Medicare and you're 65 and older, or say you have a disability or whatever that qualifies you for Medicare, and you're low income and you are eligible to apply for Medicaid, I highly recommend that you do apply for Medicaid, because what it's going to do is pay for your Part B premiums. Now, there is another component. I'm not going to go into too much detail in this video, but it is called the Medicare Saving Program, and you can apply for that when you're applying for Medicaid as well. So the Medicare Saving Programs is going to have 4 different levels. And if you have the QMB level, that means your Part B premium would be paid for and you have full Medicaid. So pretty much your co-pays and your deductibles, your co-insurance, and your monthly premiums for a Medicare Advantage plan will be covered. So you're pretty much covered at 100% or very little out of pocket. Now, you can also apply for a Medicare Advantage plan that has a dual component to it. So that is someone that has both Medicare and a Medicaid. Please take note that if you do have the QMB level for the Medicaid and you also have Medicare, Medicare providers aren't allowed to bill you for services and items that Medicare covers, including deductibles, co-insurance, and co-payments, except for outpatient drugs. Pharmacists can charge you up to a limit amount, no more than $4 in 2021 for prescription drugs covered by Medicare Part D. So if you get a bill, all you need to do is write QMB on it and send the bill back to whoever sent you the bill, because they're not allowed to charge you if they are a Medicare provider if you have the QMB level. So please keep note of that, because you're not responsible for anything additional when it comes to bills, medical bills. And you can get extra benefits such as a card to go to the grocery store and purchase healthy foods. So yeah, there is a lot of benefit of having both Medicare and Medicaid. Please also keep in mind that these extra benefits depends on the state and also the plan that you choose. So it's very important to talk to a licensed agent. I'm also available as well. My goal is to educate and not to confuse anyone or mislead anyone in any way. And if you're eligible, I definitely recommend that you apply for both. My office is located in Florida, and I can help you apply for the Medicaid and the Medicare application. If you need any assistance, I will leave my number right here. All of my services are 100% free. I represent the top insurance carriers, the most common insurance carriers. That way I can help you find the plan that best fits your needs. Anyways, I hope that you learned something new in this video. Thank you so much for watching, and please like, comment, share this video with a friend, and I will see you on the next video. Thank you so much for watching. Bye. See you on the next one. Bye.